lady from Georgia, Ms. McBath.
Thank you, Chairman Allen and Ranking Member DeSaulnier. The Employee Benefits Security Administration has the important responsibility of protecting the health benefits of over 150 million hardworking Americans on employer-sponsored health insurance. And unfortunately, a growing number of Americans who have put in their time at work and paid into their health care plans are not receiving the health benefits that they are entitled to under the federal law. With the increasing complexity of the healthcare system, the Employee Benefits Security Administration's responsibilities have grown significantly over the years, yet the agency remains chronically underfunded and understaffed. And the lack of resources at this agency means that employees continue to wait on their health care benefits, and investigations are delayed when trying to stop bad actors who take advantage of the patients. Last session, Chairman Rick Allen and we sent a letter to the Employee Benefits Security Administration about our concern over alternative funding programs in health insurance. Under the guise of saving money, alternative funding programs are pushing health plans to exclude certain medications. They abandon patients, leaving them to seek out assistance programs that are already overloaded. Ultimately, and far too often, these patients unexpectedly have to shoulder the full cost of oftentimes their life-saving medications or experience delays that can result in harmful complications. And no one should ever have to wait for a life-saving treatment. Trust me, I know. I'm a 2-time breast cancer survivor. And the reality is not everyone can actually wait for a life-saving treatment. The cases that have been submitted to the Employee Benefits Security Administration, they tell the stories of people who are just basically at their wits' end, needing help to fight an insurance denial for their life-saving treatment, or begging for oversight to investigate alternative funding programs that have cut off access to the care the patient thought that they had. And while the agency is tasked with this important role that has financial and profoundly personal impacts for all those in our healthcare system, years of underfunding and budget cuts have threatened to undermine its original intent and mission. Just this year, we have seen career federal employees pushed out of their jobs, and an additional $10 million in cuts that are still being proposed. On behalf of the millions of Americans in this country who rely on health insurance through their jobs, it is our duty to support oversight and to cut through the red tape and to protect those patients' lives. Mr. Khawar, if you will, what impact would strong investments in the Employee Benefits Security Administration have on its ability to better protect health coverage for the American people?
Thank you for that question, and I agree with everything that you've said. I mean, investing in this agency means investing in the Americans that are struggling with insurance company red tape today. It is investing in Americans who have done the right thing and saved through their job in their retirement and want to make sure that that retirement is there when they ultimately reach the right age. Unfortunately, with the budget cuts, it is hard to see how the agency is going to be able to continue to successfully achieve its mission. Things like the Benefit Advisor Program are going to be really heavily impacted. Investigations are going to be very heavily impacted. They're going to take longer. The agency is going to be able to do fewer of them. And there are going to be people that are really in need of help, who deserve the government's help, that aren't going to be able to get it, and it is 100% going to be because of resource constraints.
Mm-hmm. So why has the workforce at EBSA declined so dramatically, if you can tell us, and what can just really be done about it?
Yeah, I mean, there is a long-term problem of chronic underfunding. Costs increase, and when budgets don't, then that means you have to find somewhere. I think that it's something like 75% is about the percentage of EBSA's budget that is kind of taken up by just pure personnel costs. And so as very normal things and appropriate things like increasing salaries to account for inflation. That money needs to come from somewhere, and when you don't have many other places to look, the place you end up having to look is by reducing your headcount. So there is a longer-term issue here. The proximate cause, however, is, since January, there has been a pretty concerted effort to push federal employees out of their jobs. EBSA has not been immune to that, and so there has been as far as I can recall, a pretty unprecedented attrition rate in the last few months.
Well, thank you so very much, and I'm out of time. Thank you each and